I'm James O'Brien, and this is the ankle on the bed buttock stretch with a joint mobilization. So to begin with this exercise, you'll first want to place your ankle and your lateral calf here up on the bed. Next, what you'll do is you'll lengthen the spine. All right, this locks out the spine so that when we do bend forward, we bend forward through the hip and not the back. All right, remember the goal of this exercise is to improve hip flexion, not lumbar flexion. So get into this position, lengthen the spine. For many of you, just by doing that, it'll be a great stretch. But to increase the stretch, what you'll do is you'll slightly bend forward through the hip. For me, I get to right about here, I'm getting a great stretch in my hip. To get an even better stretch and to mobilize the hip joint, I'll take both of my hands and I'll push down into my hip crease here. And as I'm pushing down, this will help me lengthen my spine up more, but it also will stretch the back portion of the joint capsule. I'll hold this position 30 seconds to a minute. Periodically, I can also do some pulses by pulsing downward. That'll stretch the joint capsule a little bit more. Do about 2 minutes total of stretching and really help limber up that hip. When you do this, just make sure you don't get knee pain. Sometimes this can bother people's knees. So by just placing a pillow here, like this, you'll be in a little bit less external rotation. You might need to bend forward a little bit more through the hip. That can help with some knee pain. Or another option is to just really try and think about pulling that foot up towards you. That will internally rotate the tibia. And then maybe just doing one-hand pulses like this. That'll help protect the knee as well. All right, so that is the ankle on the bed buttock stretch with a joint mobilization.